For people suffering a stroke, the effects on the body can be dangerous, even deadly. But it's important to know that treatments are available. The key is to seek help immediately.
When the patient comes to us, you have a blood vessel that was supposed to be delivering the oxygen every minute to the brain. That supply has been shut down acutely, and we're losing brain cells by the minute.
Hi, Dr. Belmont. Nice to meet you.
When a stroke victim arrives at a hospital, the medical team quickly determines what type of stroke the patient is having: a hemorrhagic stroke, which occurs when a blood vessel ruptures and spills blood into the brain.
Open your eyes. Tell me what you see in this card here.
Or an ischemic stroke, which is caused when a blocked artery cuts off the brain's blood supply.
Right there. Please stop.
Using a CT scan or MRI, physicians review detailed images of the brain to examine the damaged area.
Until we get that CAT scan completed, we won't know which way we have to go, whether we need to call our neurosurgery colleagues to come and take this patient immediately to the operating room, or whether we need to think about drugs that can break up the clot.
If the diagnostic image reveals that an ischemic stroke has occurred, the first line of treatment is to administer a clot-busting medication known as tissue plasminogen activator, or TPA.
It has the ability to open up a blood vessel that's plugged up and causing a stroke. And by opening up this blood vessel, you can restore blood flow to the brain and reverse the symptoms of a stroke.
Though TPA is a powerful drug, it must be delivered within 3 hours of the onset of symptoms to be effective.
That means you need to get to the hospital, we need to evaluate you, do blood tests, do a CT scan, and get that medication into your body within 3 hours of stroke onset. And that can be very difficult to do.
Unfortunately, less than 5% of stroke patients get to the hospital in time to receive TPA. In cases where TPA is no longer an option, emergency procedures are sometimes required to gain access to the blood vessels and remove the blockages. During an endovascular procedure, a specialist makes a small incision over a blood vessel. A catheter with clot-removing instruments is then navigated through the circulatory system and into the brain.
This type of treatment allows us to travel with devices from the leg all the way into the area of the clot, remove the blood clot mechanically. And once that happens, you see the restoration of the blood flow right in front of our eyes.
Though these endovascular procedures are delicate, they are one of the new frontiers in stroke treatment. While blood flow needs to be restored during an ischemic stroke, for patients experiencing hemorrhagic strokes, blood spilling into the brain needs to be stopped.
I can see what this aneurysm that we're looking at truly looks like.
Hemorrhagic strokes can be caused when either malformed blood vessels, called AVMs, or ballooning blood vessels, known as aneurysms, rupture and flood the brain with blood. This produces dangerous pressure in the brain cavity. Hemorrhagic strokes are many times more deadly than ischemic strokes and also require immediate medical attention.
We want to identify where the blood is coming from, and we want to stop the bleeding as quickly and rapidly and effectively as we can.
Depending on the severity of the stroke, procedures may be required to stop the bleeding around the brain and relieve the pressure. Clipping and coiling are the two most common procedures.
These are the vessels. This is the aneurysm clip on the neck of the aneurysm. This is where the coils were before. Right, yeah. Okay, so this is the optic nerve, other optic nerve.
During a clipping surgery, a neurosurgeon removes a portion of the skull and locates the ruptured aneurysm. A tiny clothespin-like clip then seals off the aneurysm, preventing any more blood from spilling into the brain. Unlike the clipping procedure, coiling does not require open surgery. Instead, a surgeon performs an endovascular procedure, guiding tiny instruments to the damaged area and then filling the aneurysm with soft platinum coils.
The coils are little slinkies made of platinum that will basically fill the aneurysm in such a manner that the blood cannot get inside anymore.
Both clipping and coiling come with risks and benefits.
The advantage of clipping is that it's a very definitive procedure with long-term good results. The disadvantage is it's slightly more invasive than coiling. The advantage of coiling is it doesn't require an incision on the head. The disadvantage is that it can be associated with recurrence.
Once emergency treatment has been administered to a stroke victim, the patient is often hospitalized for several days to several weeks. Recovery is focused on rehabilitation and preventing another stroke from occurring.
Stroke care has changed dramatically in the past 10 years. We used to give patients comfort and then therapy, and that was it. What happens now is a strategic approach to stroke, and that can save lives, and then it is our job to do everything possible to prevent another one.
With new medications and procedures, strokes are now a highly treatable disease. But the best medicine is still prevention. When you take care of yourself and live a healthy lifestyle, you improve your chances of avoiding the devastating impact of a stroke.